As we age, our brows tend to descend. And as the brows come down, it piles up all this skin over the top of the eye. And the blepharoplasty is the surgery to address that. We get that tissue out from under the brow, above the eyelid, where it's causing that obstruction. And that version can be well covered by the insurance company if patients meet certain qualifying criteria. Hi, my name is Dr. Lewis. I've been an ophthalmologist here at Quigley Eye Specialists for over 20 years. I primarily handle cataract surgery and oculoplastics, which is plastic surgery around the eye and eyelid. I began medical school in St. Louis University, subsequently then gained residency in Indianapolis, where I completed my residency in ophthalmology, and moved to Southwest Florida, where I joined Quigley Eye Specialists and have been here ever since. So the technical term for eyelid surgery, or the lift the eye, is what's known as a blepharoplasty. And what that essentially is doing is removing excess skin, redundant tissue that has gotten down into the vision. A lot of folks will complain that they have reduction in the peripheral field, or that they have a shadow effect over the top of the eye. One way that this can be addressed is to surgically raise the eyebrow back into its proper position. Now, the catch there is frequently brow lifts are considered cosmetic, so they can be awfully expensive out of pocket. Fortunately, there are some procedures that can be covered by the insurance company, and the traditional blepharoplasty is one of those. So instead of lifting the brow, what we do is remove that redundancy from underneath to reconstruct and recontour that skin so it no longer obstructs the visual field. So the particular technique that I utilize for my blepharoplasties is a technique that we refer to as Bladeless. It's a stylus type instrument that generates a small electric spark, which is different than, say, scalpel or scissors. The advantage of Bladeless is very few folks ever have much in the way of any discomfort or pain. In fact, I hear the word painless quite often. Additionally, the surgery is more efficient, so the operative time is shorter. And lastly, the recovery is vastly quicker than the traditional approach. The Bladeless technique is an option that is available to most patients. However, there are a few cases where that is not appropriate. One of the large ones is implantable electronics. So pacemakers, defibrillation units, cochlear implants. Unfortunately, the instrumentation with the Bladeless equipment can interfere with the performance of some of those implants, and post-operative recovery is very simple. There are a set of stitches. Those are made out of a Teflon type material, so they come out quite easily. The patient's responsibility is essentially just to keep the eye clean and dry. No dirty, dusty environment, any kind of heavy sweating or swimming with the face in the water for about 1 to 2 weeks. If you have any questions, any concerns about the nature of your eyelids, or if it's normal or not, or would you benefit from the surgery or not, I'm always happy to see folks for consultation. We can go through all the specifics. If you have any further questions or would like an appointment, feel free to visit our website at quigleyeye.com.